Welcome back, everyone. They are a silent killer that can strike any woman at any time. Heart attacks, strokes, blood clots. Heart disease is the #1 killer of women in Canada. I'll say it again. Heart disease is the #1 killer of women in Canada. Here to help us understand the reality behind the statistic is cardiologist Dr. Paula Harvey. Please welcome her. Thank you for joining us, Dr. Harvey. So your work at Women's College Hospital is specifically focused on women's cardiovascular health. Why should women be more concerned?
Well, as you alluded to in the introduction, heart disease, cardiovascular disease, is the #1 killer of women in Canada. And if we were actually to ask women what they think is their major health risk, as we did in 2017 when 2,000 women were asked this question, the majority actually said breast cancer. And yet cardiovascular disease is going to kill 5 times as many women as breast cancer. So we have a real issue with awareness of cardiovascular disease, and that's one of what we refer to as the 5 unders. So under-aware, under-diagnosed, under-treated, under-researched, and under-supported. So the under-research is really an important part of this as well, where we need to increase awareness, increase research, so we can actually improve those statistics. It's very important.
Very important. So break it down for us. How does heart disease cause heart attacks? And then let's talk about strokes.
So the heart attack and stroke come under the umbrella of cardiovascular disease.
Yeah.
And the most common cause of heart attack and stroke is what we call atherosclerosis, which is basically due to inflammation of our arteries, which leads to build-up of what people would refer to as cholesterol deposits. So we call them plaque. So you get plaque in the arteries to the heart and to the brain. That plaque, when it continues to be inflamed, can become complicated, and it can rupture or become ulcerated. And where you have that complication, a clot can form. If you form a clot there, then you block off all the blood supply to that part of the heart or that part of the brain. You no longer get oxygen or nutrients. And if you don't get rid of that clot, either by clearing it or dissolving it, you end up with either a heart attack, which is where you have damage to the heart muscle, or if we're talking about a stroke, it's damage to the brain. So they're both part of cardiovascular disease.
Okay, and that's the difference between the two. So the major symptoms women should be looking for, what are they for heart attack?
So for a heart attack, women can present like men do with what we refer to as the Hollywood heart attack, clutching the chest and sweating like we see in the movies.
Yeah.
But women can also present with different symptoms and often articulate their symptoms differently to men. So women may talk about a pressure or a squeezing in the chest that may go up into the neck. They may have palpitations, they may have profound fatigue, cold sweat, even stomach pain or pain into the back. So
like nausea is ever?
Nausea, yep. So it can be any one or combination of those symptoms could mean you're having a heart attack.
What about stroke symptoms?
With a stroke, this is when you're having damage to the brain. And we do use an acronym to help people understand what sort of symptoms they might have. And this is it's B FAST, and it refers to B is for becoming unstable, wobbly on your feet. E is for change in vision, so you may have a change, you may see double vision or lose your vision. Then F is for face, you may have problems with drooping of the face, even drooling from the mouth.
Yeah.
A is what you may have weakness in your arms or legs, so if you hold out your arms, one of your arms may droop. S is for speech, either difficulty with speech yourself or understanding people's speech. Any of those symptoms may suggest you're having a stroke, and the T at the end is time to call 911. And so for both of those conditions, you need to be calling 911 so that you can stop the heart attack or stroke.
And there is a good chance that the faster you get help, the less damage it's going to do. Is that correct?
Oh, absolutely. These are emergencies. So if in doubt, act. That's the important thing, because if we can get rid of that clot, then we prevent the damage. Prevent you having a completed heart attack, prevent a stroke. It's critical.
So how do we reduce our chances, our risk of cardiovascular disease just in general? What should we be doing?
So it's really important for women to understand they can make a big difference to their heart and brain health, and that at least 80% of your risk can be reduced or wiped out by addressing risk factors. So for women, that means traditional risk factors. So making sure that you're not sedentary. Unfortunately, a lot of women are sedentary, overweight, not smoking, addressing if you've got diabetes, high blood pressure and high cholesterol. And then there's other risk factors that are very specific to women that also need to be addressed and that women need to be aware of. So healthy lifestyle, knowing what your risk factors are and knowing how to treat those risk factors and how to implement lifestyle and, if necessary, working with your clinician medications to reduce cardiovascular risk is really important.
So how many of you in the audience, just by a show of hands, how many of you thought breast cancer was the #1 killer of women in Canada? Quite a few hands there. Why is it that we thought, oh, I thought anyways, that it was men that were having the heart attacks, and it's because they were traditionally the breadwinners and they're traditionally the ones that are stressed out, and then women were catching up because now we're also breadwinners and we're also in the workforce. Is all of that a myth? Like, was any of that true?
It's, you know, part of this comes down to the unders that I mentioned, and particularly the under-aware and the under-researched.
Yeah.
All the research was being done on men. And that's whether you're talking about in the lab or clinical trials. Everything to do with heart disease was all focused on men. Our treatment was focused on men. And part of that problem was that all the cardiologists were men. All the researchers were men.
Yeah.
We are seeing a change now. I'm not the only woman working in cardiology these days.
Thank goodness.
Having that, that input and that voice and starting to recruit women into clinical trials, making sure actually it's made mandatory now to make sure that you're recruiting women into trials so that we are aware of what is going on, that we are testing treatments, we're testing diagnostic tools, and that we're supporting women. So it's not a myth. We were thinking it was all men.
Right.
And the women were looking after the men.
Right, but we were having heart attacks at the same time.
We were having heart attacks at the same time.
No one was just looking at us.
Exactly.
Okay, you say hormones and age play a big role in our risk for blood clots, our risk for heart attacks, our risk for strokes. Why is that?
So, hormones are really important to women. We know that premenopausal women are generally protected against cardiovascular diseases, and that's at least in part due to the estrogen that we produce from our ovaries, that it's protective, protects against high blood pressure and high cholesterol and things. When we go through menopause, that changes. So the hormones are really important. You need to, especially as you're moving through menopause, know that you're going to be at increased cardiovascular risk. But we also have other risks related to our hormones over our lifespan. So pregnancy is really important. It's a woman's first stress test. And there are complications of pregnancy like diabetes and high blood pressure in pregnancy that put a woman at higher risk of both those risk factors and heart disease at a later age. The contraceptive pill increases risk of stroke, particularly in women who smoke. So we really need to think about our hormones and what's happening with our hormones over our lifespan combined with age, because that really impacts our cardiovascular risk. And we're starting to learn about that. But many clinicians still don't pay attention to it. They don't ask about it. And women themselves need to have this knowledge so that they can say, hey, I had gestational diabetes. That puts me at risk, 7 times the risk of diabetes in older life and double the risk of cardiovascular disease, just as an example.
I did not know that. I remember being tested for gestational diabetes and actually liking the orange juice they gave me. I was like, oh, that's delicious. Maybe it's because I ate everything when I was pregnant. But I wasn't diabetic, but I did not know if I was, my chances of having diabetes later were increased. I didn't know. This is information that isn't passed on to us. So thank you for the work you do and for all the info you gave us on the show today. Thank you so much.